Hi, I'm Dr. Dan Lieberman. I'm a psychiatrist, a clinical professor of psychiatry, and the SVP of Mental Health at Hims & Hers. Wellbutrin is an antidepressant that contains the active ingredient bupropion. Like other antidepressants, it works by modifying the activity of brain chemicals called neurotransmitters. Specifically, Wellbutrin works on two neurotransmitters called dopamine and norepinephrine. Unlike most antidepressants, most famously the SSRIs, Wellbutrin doesn't have any effect on serotonin. That's got advantages and disadvantages. The disadvantage is that it means it's not as good for anxiety. The advantage, though, it means it doesn't have sexual side effects and it doesn't have the same risk for emotional blunting as sometimes the SSRIs do. Because it boosts dopamine and norepinephrine, Wellbutrin might be particularly good for people who have low energy, low motivation, and difficulty with focus and concentration. Now, other antidepressants like SSRIs can also help with these symptoms, but sometimes Wellbutrin does it the best. Some people get very lucky and they start to feel better within a few days, but that's pretty rare. Usually you have to take it every day for about 2 weeks before you start to notice the effects, and then it takes 4 weeks, sometimes even longer, to get the full effect of the medication. It takes a little bit of perseverance, but once it starts working, you'll be glad that you did. If you're not sure if it's working or not, it probably isn't. When an antidepressant is effective, it can be revolutionary and very, very dramatic. The effects sneak up on you slowly, but a lot of patients tell me that they wake up one morning and they suddenly realize, I'm not depressed anymore, and it's a wonderful moment for them. If you're still experiencing symptoms of depression, even after taking Wellbutrin for 2, 4, even 8 weeks, it's probably time to talk to your provider about changing the dose or maybe trying something new. The combination of an SSRI and Wellbutrin is actually a pretty terrific one. It's one I use a lot with my patients. A lot of times we'll start an SSRI, oftentimes because both depression and anxiety are present, and the SSRIs do a little bit of a better job with that than Wellbutrin, but Wellbutrin can add some additional benefits. Sometimes SSRIs don't treat all of the symptoms, and the combination of the two will often lead to a full remission when one alone didn't do the trick. Sometimes SSRIs can cause emotional blunting. People might feel a little bit flat, and Wellbutrin reverses that in a beautiful way. It perks you up, gives you motivation, and increases your interest in the world. Finally, about 50% of people who take SSRIs experience sexual side effects, decreased interest in sex, and difficulty reaching orgasm. Wellbutrin does a beautiful job of reversing this, so that if the SSRI is working well for the depression, but the sexual side effects are a problem, by adding Wellbutrin, it can boost the effect and allow someone to continue taking a medication that's working well. Thanks so much for watching. And don't forget to subscribe so you don't miss a single episode about mental health topics and how to feel your best.